Welcome to Ultimate Speech Sounds. First things first, thank you for taking the time to join me here today for this presentation. Your time is valuable and I promise you will not be disappointed. My name is Kate Beckett and I'm a dual qualified speech pathologist and nurse. I present across the UK and Ireland on the topic of speech sound disorders and the digital platform I am developing for its assessment and treatment, which includes my avatar Dara, seen here on the bottom left. And now time for the disclosure. My relevant financial relationships are that I am the owner of Ultimate Speech Sounds. I'm also the author of the clinical textbook called Ultimate Speech Sounds. I'm in receipt of grants from Enterprise Ireland for business development. And I also own resourceable.com, where I sell SLP digital resources. My relevant non-financial relationships are as follows. I am a volunteer at the Irish Association for Speech and Language Therapists. And I also own and operate speechtherapyforparents.com, which is a free website. Okay, let's get down to business. The theme of this conference is Elevate. And I want to talk to you about elevating speech therapy through technology. Technology as an enabler. Today, we're going to be talking about the future of speech sounds. There are 3 things I would love to know your opinion about. Take a moment and scan this code whenever you're watching this presentation and let me know what you think. So here I am at 6 years old, growing up in the UK with what's quite possibly one of the most horrible uniforms. And I decided to travel the world. I've been to all different places around Asia, I've hiked and camped around southwest of America, I visited Australia and New Zealand. And my passion for adventure didn't stop when it came to my career. I took my first job over in New Zealand. Then I went back over to the UK and finally I've been here in Ireland. Working in these 3 different countries has given me an international perspective on how speech therapy is working around the world. And I wanted to think of one image that would sum up everything that I have learned from my international career. What I saw was firefighting. Firefighting against the demand. We have each other's backs, just like these firefighters in this image. We look out for each other and we're trying to help each other, but the flames keep coming. We're trying to hold them back and do the best that we can for our students. And the question I asked myself was why? Why, when we've come from this technology into this technology, is it that we're still doing the same thing? After all, technology has never been more available and more accessible by our students than it is now. So why aren't we using it? Why aren't we getting it to help us help them? Now you may say to me that we need more SLPs. We need more resources. And I would say, yes, absolutely. I agree with you 100%. But we don't have them. So what are we going to do? How can we cope in the meantime when we don't have enough SLPs and we don't have enough resources? And do you know what we're doing to ourselves? We're burning out. The statistics in the research support that burnout rates have never been higher in speech therapy than they are now. Why is it that we're trying to juggle everything? think a lot of opinions around technology has to do with fear. Like in the movies, that this big, scary AI army is going to come and take over our role. When in fact it couldn't be further from the truth. I think the key is that we, as speech therapists, need to take control of what technology is out there and how it is used and implemented in our profession. I see technology as a tool. A tool that makes my coffee. A tool that other professions have used to make their work faster, more efficient and more accurate. And I think we need that in our profession too. After all, a tool is there to help us, to make us more efficient so that we can help more of our students. And I think this is the key message of where speech sound disorder treatment is going in the future. A technology tool, not a replacement, a tool to help us with the demand, a tool to help us help those students. Because after all, that's what we want to do as speech pathologists. We want to help, and the tool is the answer. And I would love your input. Scan this code and let me know your answers. If you Google speech sound apps on iTunes or on Play or wherever you get your technology from, then what you will see is there are lots of different apps out there. Some we know, some we're familiar with, some we use, some we prefer. However, I would add a word of caution. I've been looking into this a lot, and compliance is a huge issue. For HIPAA compliance, for GDPR, depending on where you're based in the world, just check that the tool you're using is compliant. Because a lot of them either don't talk about compliance or don't clearly state where they're storing their data. And this has a huge impact on our students. Technology makes these platforms available all around the world, so we need to look at the international compliance issues. Compliance is just one of the 6 steps that I wanted to cover in Ultimate Speech Sounds. Through all the research I've been doing looking into what technology is available for speech pathologists, I've noticed that there are a few key factors which are missing. We know that pathologists use a mixture of different types of approaches depending on what they see in the child. And what I've noticed with these technologies is that they don't always support this approach. Very often they are playing games, but they're not actually underpinned by all that research. We're really lucky in that way. There are decades of research to support what approaches we should be offering to our students. And I think that that's why technology hasn't really taken a firm grip in helping us in our profession. Simple usability. This is something that is integral to whether the students and the parents will be able to use the app, or whether you will use the app when it comes to actually delivering the therapy. Data analytics. This is probably one of my favourite, because how do we measure change if we don't have the data? Data needs to be recorded so that we know we're making the correct therapeutic decisions. A collaborative interface. It's not just us practicing speech sounds with children. We have to rely on home practice. I believe that everybody should have access to the same resources for helping children practice their speech sounds. And because we rely so heavily on parents doing this work at home, it means that the parents need to have access to our resources, as do the grandparents, to aunties and uncles or teachers who are helping their children practice their speech sounds. The evidence shows us that we need to deliver consistent, high-intensity speech sound practice to get those real therapeutic gains. And I think technology offers us this opportunity. The sixth step that I wanted to tackle in Ultimate Speech Sounds was accessibility. And what I mean by this is whether you have Apple or Android, whether you're using a phone, a tablet, a computer, I strongly believe that everybody should be able to access the platform and use the technology to help their child and students, no matter what device you're using. And that's exactly what I'm providing. We also offer a completely unique child avatar, so we have peer-to-peer learning, who demonstrates the speech sounds in isolation in 7 different accents. Meet Dara. I've talked a lot about my personal experience from the 3 countries that I've worked in, but I think it's important that we have a look at those statistics. So the key message here, we are not alone. McGill et al. Have done a lot of research in this area, and what they have found is that the waiting lists are continuing to grow on an international basis. In the States, ASHA did a survey last year, and that found that 47% of positions are funded but unfulfilled in speech pathology. In Australia, the Speech Pathology Association is calling on the government for urgent action because they need more therapists. In Ireland, we have over 32,000 children on the waiting list, and that's just for an initial assessment. In the UK, the speech pathology vacancy rate is 23%. That's twice that of nursing. In New Zealand, they predict they're going to need over 2,000 more therapists in the next 5 years. While in Canada, they're predicting 700 new speech pathology jobs every year until the year 2031. And in South Africa, the supply-need gap is nearly 3,000 pathologists. This is an international crisis, and we need to do something to help our students. What's very clear from these statistics is that how things are running at the moment is not working. We need more help, and we need to do better for our students. The research shows that even prior to COVID, that our students were not getting the therapy they needed, and if they did get some, they weren't getting enough. This exponential demand is being reflected in the research, such as that by Su et al., who last year showed that the levels of stress and burnout in speech pathology have never been higher than they are right now. Let's talk about the gap. By the gap, I'm referring to the evidence practice gap. This is huge. We have the research and we have practice. And somehow the two are still not meeting in the middle to actually enable us to deliver sufficient and effective therapy. We need to jump that gap, bring the two together, find something realistic which is going to allow us to implement the evidence-based practice into daily lives. We're very lucky that we have so much evidence for our profession, but we need to find a way to implement it. We need to implement the evidence into practice. And this is something I think is a bit of a mismatch still to this day. And that is what I'm trying to address. Currently, a lot of the time we have to rely on parents to deliver the practice at home. But this causes its own issues. Research such as that by Tambrea shows that parents feel a lack of confidence. They're not sure what they're supposed to be doing or quite how they're going to do it. And trying to find the time is really difficult as well to fit the practice into a daily routine. To summarise everything we've talked about so far, we know that it's not currently working effectively. We know that there's a gap between the evidence and the practice. And we know that parents need our help if they are going to effectively deliver the practice at home that we need them to do. When we're talking about speech sound disorders though, I've used this image here because it's this constantly evolving shape that, depending on what demands are pushing on it at the time, makes it bend and change, and it's quite hard to actually pin it down and define clearly what it is. We've got caseload, dose, duration, demand. We have workload, financials. We have a waiting list, and we have evidence-based practice. Then we have the frequency, we have the service delivery, we have the agent of therapy, and we have resources, all pushing and pulling on speech sound disorders, changing and constantly evolving what it is we're going to be treating and how we're going to do that. All these different factors need to be considered when thinking about the treatment of speech sound disorders. This is where I've come up with the concept of urgent versus important. Links back in again with the firefighter. We're so busy treating the urgent, the here and now, who we have on the wait list at the moment, who we're going to see in the next half an hour, that I think the important, the evidence-based practice, how we're planning for the future, how we're going to make things work and fix what's happening at the moment, it's kind of getting pushed to one side a little bit because we have so much urgent pulling us. This is where I think we need to take a bit of a reality check. And again, this is reflected in that evidence practice gap. We have the ideal scenario of how we deliver our chosen approach in therapy, our who, what, where, when, why. And we actually have the reality that we won't always be available because there's not enough of us. The child might call in sick that day and not be able to do practice. There might be other demands. Siblings might be unwell or need other medical appointments. So we have this whole different reality of what the world actually looks like when we're trying to deliver therapy. And I think we need to pay a bit more attention to the reality of the situation when we're thinking about the future of speech sound disorders. I've identified as a speech pathologist myself that we know what we need to do, but we just haven't quite figured out how to do it. And I think as the future evolves, they're going to have more and more demands pulling on us, changing that shape of what SSD is. And I think we need to really start getting a handle on it. And this is the challenge I've decided to take on with Ultimate Speech Sounds. Let's have a look at the math. You might ask, math in speech pathology? Absolutely. Let me explain our equation. We have a finite number of speech language pathologists, and we have evidence-based practice. We know that these two things are fixed because there's a limited number of speech pathologists, and the evidence base is what we're targeting. It is the outcome. So what does that leave us with in our equation? Well, it's the variables. And I believe the variables are something that we need to have a very close look at for the future of speech sounds. Waiting is no longer an option, and nor should it be. Students deserve better, and we need to find a better way. In the current situation, home practice is one of the key variables that we have open to us. but we need to make it work harder for us. Home practice is what I'm focusing on through Ultimate Speech Sounds. But what are the key things that we need to understand from home practice that would make it work better for us? We need to know if it's being done, when it's being done, if it's being done correctly, if it's being done consistently. Are enough trials being done? Are we hitting that sweet spot of 100 trials? And of course, we need to know if the therapy is actually working. We can harness technology to help us answer all these questions. Technology in speech pathology is not new. Schreiberg started using it in the 80s. But Schreiberg didn't have access to the type of technology that we do today. Technology has caught up with us. Technology can allow us to get all those insights into home practice. And this is what we're developing through Ultimate Speech Sounds. Think again how far technology has come, from cassette tapes to iPads. We need a future mindset. We need to stop focusing on the urgent and look at what's important for our future. We are offering a single platform where evidence-based therapy can be delivered to children with speech sound disorders. It provides the evidence-based, high-frequency, high-intensity practice that speech sound disorders have been shown to respond to. And it also offers all those data insights that can help us make those therapeutic decisions. Remember, this is a tool for you. This is going to help you help parents in between your sessions. It is not a replacement. This is intended to be used by the pathologist so that we can put the practice into the parent's hands for those days in between the speech therapy sessions when we see the student. Research papers have been written that have reviewed the technology available at the moment. And while they support technology, recognizing that it can offer the consistent and high intensity practice we need in speech sound disorder treatment, it identifies gaps where data is not being recorded, that it's not compliant, that it's not giving us the feedback that is available from all that home practice being carried out. One huge area is that technology would actually reduce our admin burden. Hooray, I hear a lot of you cry. Our admin burden is pretty much a 1-to-1 ratio in many situations. This needs to change. It is not a good use of our time. This would enable SLPs to focus on the therapy and not be bogged down in all that paperwork. We can use the metrics offered by Ultimate Speech Sounds to refine our therapy, to tailor therapy to each child's individual therapeutic journey, ensuring that we're delivering targeted, effective therapy through our tool. Think of it as a parallel between what a stethoscope is to a doctor, as Ultimate Speech Sounds will be to an SLP. If we can objectively capture and monitor data, we can offer guidance to parents, detailed progress reports, and we can use all that crucial data to help inform the evidence base and make therapy even more effective in the future. This will make therapy more responsive to each child's individual needs. Technology has never been more available. Children already have it in their hands, so why not bring the learning to them on their devices and also enable evidence-based practice through high delivery, consistent practice. They can use it at home, they can use it with their families, and they can bring it into school. Technology has the ability to bridge the evidence-practice gap. And I think it's more important than ever that we make our best efforts to jump, reducing the admin burden and bringing therapy into reality so that it can be delivered effectively for our students. And empower their parents in the practice they're doing at home with their child. After all, who is more motivated to help their child than the parent? I really believe that we're finding a way forwards here with Ultimate Speech Sounds. Technology as the way forwards in speech sound disorders. You can be part of this solution. You are the professional and I really value your opinion. There are 3 things I would like your opinion on. If you could scan this code whenever you're watching this presentation and let me know your answers, I would really appreciate it. Literally just 3 circles and it would give me a huge insight to help me keep moving forwards. We're exhibiting here at the ASHA convention in Seattle. We're up on the 2nd floor in booth 3125 if you want to come say hi. I really hope that you have found my talk interesting and it's given you some food for thought. Let's find our way forwards in speech therapy using technology. Thank you.